SAGE stands for Support, Advocacy, Growth, and Employment, and it is the largest outpatient behavioral health program here at DESC. The team comprises of case managers, therapists, intake specialists who are working to provide longer-term support for clients coming into services. When we're talking about clinical care, we're talking about a continuum of care, and so there's various programs that are trying to answer a certain need. SAGE is at the end of that, and so folks will move along the continuum and hopefully end up at SAGE where they will receive the longer-term care that they need. In the terms of kind of like the whole clinical pie, SAGE is a very important piece.
What I like about working in SAGE is I'm able to work very directly with the clients. We can kind of pinpoint what's going on. A lot of our clients at DSC overall are what we consider the most vulnerable. And I think with SAGE, we're able to kind of check in and make sure that they're getting the right things that they need and giving them mental health guidance, being able to kind of like remind them what their goal is and be able to give them different tools to cope with that.
The SAGE program, we're going to be the biggest behavioral health program that's located at Hobson Clinic. This is the first clinic of its kind in Washington State, and so we really are kind of setting the standard of like what future clinics like this can look like.
There's a lot of challenges in American healthcare right now. We don't have to do things the way that they've always been done. DSC and Harborview, with their plans for Hobson Clinic, this could serve as a model for other populations, other groups, other regions. The reason why Hobson Clinic is so remarkable is this is really an opportunity for us to take care of the whole person. So in addition to having a behavioral health clinic, a primary care clinic, and housing, there's really few other locations like that here in Washington State.
We're talking about holistic care and easier access to services. Getting a client from A to B, that's a process in and of itself.
It'll be essential for especially a lot of the clients who we see are like not very mobile, or we have a lot of the clients who have fears of just going to like the hospital or going to a clinic. By helping SAGE and helping DSC, I think we could honestly make things a lot better out there, not just for our clients, but for the community.